Hello, everyone. Welcome back to Neurospicy Nursing. This lecture is on pediatric emergencies. There is another pediatric emergency that is not on this PowerPoint, but I did a full five-slide fix on, and that is sudden infant death syndrome. Um, so make sure that you watch that because it is still considered a pediatric emergency. However, um, since we went over it in Mother Baby, it was kind of its own thing, and I didn't want to repeat the information. So make sure that you guys watch that. All right, so let's go ahead and get on into it. So, the biggest thing to remember with pediatric emergencies is that they are 90% pattern recognition and 10% trying not to panic, both yourself parents and trying to keep the kid as calm as possible. Obviously, easier said than done, but 90% pattern recognition, 10% not panicking. So hopefully by the end of this lecture, you guys will be able to understand some of the most common pediatric emergencies other than SIDS because I have a full lecture on that. Know what to do quickly for both the child and the caregiver. Teach families how to prevent these emergencies from happening in the first place. So, all in all, the three things that you need to learn from this lecture is how to recognize, how to respond, and how to prevent. That's really base level. All right, so the first thing that we're starting with is drowning, which is one of the most preventable pediatric emergencies. So, what is drowning? It is asphyxiation from submersion, and it can happen in 1 inch of water. You do not need a lot of water to have drowning, okay? Some of the most common locations are going to be bathtubs, toilets, buckets. I want you to keep in mind buckets, especially when you have a child that's starting to be able to stand by themselves, okay? Their head is still very heavy. They can stand by themselves, but that doesn't mean that they can fully keep themselves upright. So they could be holding onto the bucket and topple over and into the bucket. So buckets are a common location of drowning. Washing machines are another one. Randomly climbing into it. Mom's tired, doesn't realize baby's in there. Plop. Unfortunately, drowning. You know, it's very unfortunate. Same thing can happen with like dogs and cats. You might not realize that they're in the washing machine. Boom, drowning. Lakes, ponds, and streams are other common locations for uh drownings as well as at-home pools. So major risk factors are going to be ages 1 through 4, poor swimming skills, no supervision, no life jacket, as well as diving injuries like diving in a shallow area, head injury, and there's also maltreatment and neglect. Um, Another one is just, unfortunately, when you have a small child, being tired, being tired, not realizing what they're doing is another risk factor. So, priorities is going to be knowing the exact timeline, where did it occur, when did it happen, and how long were they submerged? What type of water were they in, i.e., like were they in a bucket with like dirty water? Were they in a pond, fresh water, salt water, that sort of thing? And the temperature of the water is also important, right? Because littler humans can become hypothermic very quickly. So if they're in freezing cold water, that adds a whole other layer um, of issues basically on top of drowning. Full respiration and neuro exam is going to happen, right? Because during drowning, there's hypoxia. Um, so that can affect the neurological system. They're also going to rule out spinal injury that has to deal with the diving injuries. You know what I mean? Diving, hit your head, can damage your spine. And we should be doing ABGs and chest x-ray to rule out aspiration pneumonia. Um, just because, inhalation of the water. Nursing interventions are going to be monitoring their vital signs and their O2 stats, very important. Administering oxygen, they're going to do chest physiotherapy, and then we're going to watch for late effects of cerebral edema, respiratory distress. If they have um, pneumonia, we can give them antibiotics, especially if they ended up inhaling like dirty water. And we are going to keep their caregivers up to date because these drowning events are extremely traumatic. The other thing that we have to remember is just because they're out of the water does not mean that they are out of danger from a drowning incident. Effects of a drowning incident can happen hours later. Okay, so a bruit or a brief resolved unexplained event. Bruits are basically the medical version of our baby scared us half to death, and then they acted totally normal because that's essentially what is happening. A bruit is when an infant now suddenly, without cause, has apnea, a color change, a change in muscle tone, a change in level of consciousness, and then they randomly recover very quickly, which again, it's absolutely terrifying for caregivers and parents. They may end up getting a workup like a septic evaluation, an EEG because they could be having some sort of seizure, an MRI or an EKG. Some heart defects can cause periods of apnea as well. When we get into congenital heart defects, um, we'll learn more about it, but just know that's another cause. So, nursing interventions, we're going to prep the infant and the caregiver for any procedures that they need to have. They are going to have continuous cardiorespiratory monitoring, strict I's and O's, and then we're also going to monitor them for reflux precautions because reflux can also cause aspirations. All right, the other thing to remember about bruits is that they're basically a tiny plot twist with no warning and no explanation. So, they will happen. All of them happen with no warning, no explanation. You're not just seeing a sign of your child acting abnormal and then they become apneic. No, they will just randomly become apneic. All right, so poisoning. Poisoning is extremely common in toddlers because everything is a snack until you can prove to them otherwise. And then even then they won't believe you and they'll still try to make it be a snack. Some of the most common substances are going to be medications, illicit substances, cleaning products, plants, cosmetics, and heavy metals. The other thing to remember about toddlers, they have at this point, they're kind of developing that sense of independence. They can run around the house as much as they want. They can get to things. So baby-proofing houses is also very important to prevent situations like this. All right, the assessment is all dependent on what was ingested, how much they ingested, when they ingested it, where did they find it at. Um, and the rest of the treatment just really depends on the substance that was ingested. Nursing interventions could include anything from a gastric lavage, activated charcoal, specific antidotes. We are going to need baseline INOs, CR monitoring, vitals, and neurochecks, and education for the caregivers, like baby proofing their houses, keeping a closer eye on their child. And again, just to reiterate, treatment depends entirely on the substance. Other thing to remember with toddlers, specific toddler logic. If it fits in my hand, it fits in my mouth. So anything that will fit in their hand, anything that they can grab onto and put in the palm of their hand will be going into their mouth because that's also how they get to understand the world around them. So keep that in mind. If it fits in my hand, it fits in my mouth. They will put it in their mouth. That also goes along with choking hazards for toddlers. Same thing. If it fits in my hand, it fits in my mouth. Okay, this is not important for testing purposes, but more important just as a human, as a nurse. This number is the number for the poison control in the United States. Um, poison control really is the cheat code for any toddler's chaos if they ingest anything. So just keep this number in mind, keep it in your cell phone. It could help even if you're at the store and you see a mom who's freaking out because their child randomly decided to put something in their mouth. Voila, you have poison control's number. Every nurse, every parent, really everybody should know this number. Okay, here are my resources. And thank you guys. That was everything for the 5 slide fix on pediatric emergencies. Just sharp, short, and everything you need to know for your testing purposes. Pretty much just how I like it. Um, and that's all I have for today. Tomorrow, I will be uploading a video on more of the psychosocial um pediatric related content. We talked a little bit about it when we went over growth and development, talking about PJs, stuff like that. It's a little bit more in depth, just because I figured you guys would like something like that. So yeah. Also, I did get a comment a few days ago requesting a video on circumcision care. So I will be posting that as well. No guarantees it'll be tomorrow, but sometime this week. Expect the circumcision care video. All right, that's all I have for you guys. Thank you so much and have a great day. Bye.